Vitamin D is an essential nutrient that plays a crucial role in several important functions within your body. It helps maintain a strong immune system and aids in the absorption of calcium, which is vital for keeping your bones healthy and strong. Unfortunately, studies estimate that nearly half of the adult population does not receive an adequate amount of vitamin D, commonly referred to as a vitamin D deficiency. What makes this even more concerning is that, over time, a lack of vitamin D can contribute to various health issues, including heart disease, diabetes, immune system disorders, and even certain types of cancer. The first step in preventing vitamin D deficiency is to recognize its most common signs and symptoms. In this video, we'll discuss 8 warning signs that may indicate your body needs more vitamin D. Number 1. Falling ill more frequently. If you find yourself getting sick more often than usual, this could be one of the clearest indicators of a vitamin D deficiency. Since vitamin D plays a significant role in strengthening the immune system, every cell in the human body has a receptor for it. A lack of this vitamin increases the risk of developing respiratory infections and may even lead to experiencing more frequent common colds. Number 2. Muscle pain and spasms. Muscle spasms and pain are 2 of the most frequently reported symptoms of vitamin D deficiency. Since vitamin D receptors are present in every cell of the human body, including nerve cells responsible for sensing pain, a deficiency can lead to muscle cramps, weakness, and in extreme cases, even paralysis. Additionally, vitamin D deficiency has been linked to multiple sclerosis, a disease affecting the brain and spinal cord, leading to inflammation and nerve damage. Research indicates that individuals with low vitamin D levels are at a greater risk of developing this condition. Therefore, maintaining adequate vitamin D levels is essential for healthy muscles. Number 3. Slow wound healing. If you have wounds that seem to take longer than usual to heal, this might be due to insufficient vitamin D. This vitamin plays a crucial role in helping the body process keratin, a protein that is essential for skin health. Some medical experts suggest that a lack of vitamin D impairs the body's ability to generate new, healthy skin cells, which slows down the healing process. Number 4. Declining cognitive function. The biologically active form of vitamin D has neuroprotective properties, meaning it helps preserve nerve function, which is crucial for proper brain function. Research strongly suggests that vitamin D deficiency contributes to reduced cognitive ability. In fact, studies show a strong connection between low vitamin D levels and an increased risk of developing dementia and Alzheimer's disease. Furthermore, individuals with severe vitamin D deficiencies are up to 4 times more likely to experience cognitive impairment. Number 5. Weaker bones. Many people don't realize the strong link between vitamin D and calcium absorption. Vitamin D helps the body absorb calcium from food, which is necessary for maintaining strong bones and teeth. Without sufficient vitamin D, the body cannot absorb enough calcium, leading to weakened bones over time. Consequently, the body starts drawing calcium from bones, making them brittle and fragile. People with long-term vitamin D deficiency are more prone to losing bone mass, experiencing bone pain, and suffering from mobility issues. In fact, studies have found a significant correlation between chronic lower back pain and vitamin D deficiency. Additionally, those suffering from arthritis or chronic pain conditions are more likely to have low vitamin D levels. Number 6. Persistent fatigue. Life can be demanding, and most people are accustomed to feeling tired throughout the day. However, what many don't realize is that chronic fatigue may be linked to vitamin D deficiency. Since vitamin D plays a key role in supporting bones, muscles, and overall bodily function, a deficiency can lead to extreme exhaustion. This symptom may manifest as daytime fatigue in otherwise healthy individuals or extreme exhaustion in those with chronic illnesses or autoimmune conditions. Studies have consistently shown that people with vitamin D deficiency report higher levels of fatigue compared to those with sufficient levels. Fortunately, supplementing with vitamin D often resolves this symptom. Number 7. Depression and mood swings. If you've been experiencing heightened feelings of depression, this could be another sign that your body lacks vitamin D. While not all medical professionals agree on the connection between vitamin D deficiency and depression, strong evidence suggests that low levels of this vitamin can significantly impact mood. Research has shown that supplementing with vitamin D can alleviate symptoms of depression, particularly in individuals who suffer from seasonal depression during the fall and winter months. This makes sense, as vitamin D levels are closely linked to sun exposure. Vitamin D supplements are commonly used in assisted living facilities to improve mood in elderly patients who have limited outdoor activity. Number 8. Poor vision. Vitamin D deficiency may also contribute to vision problems by impairing the eye's ability to adjust properly to changes in light. When the body lacks sufficient vitamin D, the pupils may not constrict properly in dark environments, leading to heightened sensitivity to bright light. Adequate levels of vitamin D are necessary to support healing in the cornea, thereby promoting clearer vision. Some studies also suggest a link between low vitamin D levels and an increased risk of age-related macular degeneration, which is a leading cause of blindness in older adults. In fact, research indicates that individuals with low vitamin D levels have nearly twice the risk of experiencing poor vision, with 1 in 5 people with a deficiency suffering from vision impairment. Number 9. Frequent mouth ulcers. Another area to pay attention to when considering vitamin D deficiency is your mouth. A lack of vitamin D can lead to the development of mouth ulcers, commonly referred to as canker sores. These small sores appear inside or around the mouth and can be painful, presenting as red or white patches. They can last anywhere from a few days to several weeks. If you practice good oral hygiene yet still experience frequent mouth ulcers, it may be worthwhile to have your vitamin D levels checked. While vitamin D deficiency is a widespread issue, certain factors can further increase the risk. Since the body produces vitamin D when exposed to sunlight, individuals who spend excessive time indoors, live in extreme northern or southern latitudes, or wear overly concealing clothing are at higher risk of deficiency. If you suspect that you may have low vitamin D levels, it's important to get a blood test to confirm. The good news is that correcting a deficiency is relatively easy. You can increase your sun exposure, consume more vitamin D-rich foods such as fatty fish and fortified cereals, or take supplements. Recognizing the symptoms of vitamin D deficiency can help you better understand its impact on your overall health. Once you are aware, making simple dietary and lifestyle adjustments can ensure you get the necessary nutrients and sunlight exposure for optimal vitamin D levels. However, if you're experiencing multiple symptoms from this list, it may be a good idea to schedule a blood test to determine whether you are deficient in vitamin D. If you found this video helpful, be sure to like and subscribe to our channel. Also, share this video with others to help spread awareness about the importance of vitamin D. See you next time.